Hello everyone, I'm Dr. B from Doc Be Well. Welcome back to our health and wellness channel. Today we're diving into an important topic that affects many individuals living with diabetes, diabetic nephropathy. I'm a board-certified family physician and I've treated thousands of patients with diabetes and many who have developed kidney disease. On today's episode, we'll discuss what it is, its prevalence amongst those with diabetes, the vital role our kidneys play, and most importantly, how we can prevent and treat this complication. So let's dive right in. The following information is meant to be a resource but not medical advice. Opinions are my own, but based on over a decade with direct patient care. Please consult your primary care provider for any questions or concerns. Diabetic nephropathy is also called diabetic kidney disease. It's a serious complication of diabetes. It's the leading cause of chronic kidney disease and need for hemodialysis in the United States. Approximately 1 in 3 patients living with diabetes, either type 1 or type 2, have diabetic kidney disease. It's defined by the presence of a particular protein called albumin in the urine. This protein is not normally found in the urine because the kidney's job is to filter it out. When we detect albumin in the urine, it can indicate there's damage. Diabetic nephropathy is caused by high blood sugar, increased blood pressure, high cholesterol, smoking, the amount and origin of dietary protein, and of course, genetic predisposition. There are 5 stages of chronic kidney disease. In the first stage, we normally only see a small, microscopic amount of protein in the urine. The kidney is working normally at this point, but as the damage accumulates, the patient advances to the next stages until they reach the final stage, which is known as end-stage kidney disease or kidney failure. Patients in this stage are often dependent on hemodialysis to help filter the blood because their kidneys are unable to do the job. Now that we've touched on what diabetic nephropathy is, let's take a moment to understand the incredible job our kidneys do in maintaining our overall health. Think of the kidneys as the body's filtration system. They come in pairs located just below the rib cage on either side of the spine. As we zoom into the kidneys, it's made up of tiny structures called nephrons. Think of them as the kidney's individual workers. Each kidney has about 1 million nephrons, and these are the key players in the kidney's filtration process. When we eat and drink, our bodies take in nutrients and produce waste. The bloodstream carries this waste, and that's where the kidneys come into play. They filter our blood to remove waste products, excess fluid, and electrolytes, ensuring that our internal environment stays just right. Not only do the kidneys filter waste, but they also play a crucial role in maintaining the right balance of fluids in our body. They adjust the concentrations of urine to regulate water levels, helping us stay hydrated and maintaining the right balance of salt and minerals. The kidneys contribute to regulating blood pressure. They release some hormone called renin, which helps control blood pressure by maintaining the balance of salt and water in the body. So, in a nutshell, our kidneys are like the unsung heroes, working tirelessly to keep our bodies in balance. Understanding this helps us appreciate why it's so important to protect them, especially for those managing diabetes. Now let's explore how diabetes can impact these vital organs. When someone has diabetes, their blood sugars can become elevated. Over time, this excess sugar can damage the tiny blood vessels within the nephrons, those hard-working units in our kidneys. Now think of it like a traffic jam. When these vessels get damaged, the filtration process slows down and waste starts to accumulate in the blood. But that's not all. Enter high blood pressure. Another common companion to diabetes, high blood pressure puts extra stress on the blood vessels, including those in the kidneys. Imagine your blood vessels as narrow roads. With high blood pressure, it's like trying to push too many cars through at once. This added pressure can further contribute to kidney damage. Diabetes and high blood pressure often go hand in hand. When they team up, the risk of kidney damage becomes even more significant. It's crucial for those managing diabetes to keep blood sugar and blood pressure levels in check to protect those vital organs. Diabetic nephropathy doesn't always shout for attention. In its early stages, you might not notice anything unusual. However, as it progresses, symptoms may include swelling in the ankles, fatigue, difficulty sleeping, changes in urine output. If you experience any of these, it's essential to bring them up with your healthcare provider. Regular checkups are key to early diagnosis and treatment. Your healthcare provider may perform simple tests, including checking for the presence of protein in the urine and measuring your kidney's function with a blood test. We can diagnose chronic kidney disease after abnormal tests over a 3-month period. Remember, there are 5 stages of this chronic disease. So, catching diabetic nephropathy early can help manage and slow down its progression. Regular checkups and understanding the stages of chronic kidney disease are vital steps toward preserving kidney health. One of the most powerful tools in our arsenal against diabetic nephropathy is adopting a healthy lifestyle. It's not just about managing the symptoms, but actively working towards preventing further complications. Here are some key lifestyle changes to consider. 1. Blood sugar control. First and foremost, keep your blood sugar levels in check is crucial. Consistent high blood sugars can wreak havoc on your kidneys, making regular monitoring and management of your diabetes essential. 2. Blood pressure management. Alongside blood sugar control, managing blood pressure is equally important. High blood pressure can accelerate kidney damage, so adopting lifestyle changes and, if necessary, medications to keep it in a healthy range is vital. 3. Healthy lifestyle habits. Incorporating a well-balanced diet rich in fruits, vegetables, and whole grains can provide essential nutrients and support overall health. Additionally, maintaining a healthy weight and engaging in regular physical activity can significantly contribute to kidney health. Staying well hydrated is another crucial aspect to kidney health. Water helps your kidneys remove waste from the blood through the urine. Aim to drink plenty of water throughout the day and listen to your body's signals for thirst. Lastly, it's important to be cautious with certain medications. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen, commonly used for pain relief, can have an impact on kidney function. Limiting or avoiding their use, especially if you have kidney concerns, is advisable. Always consult with your healthcare provider before starting any new medication. Thank you so much for joining me today and listening to this important health topic. We plan to release more videos like this one, so if you enjoyed, please press the like button and subscribe if you want to see more content about wellness and health. Check out our other videos on diabetes and high blood pressure. If you're looking for a primary care provider who can help manage these chronic diseases, and if you live in the state of Washington, consider joining our practice. You can find more information by going to our website, www.docbewell.com. And as always, from my home to yours, wellness is a journey, not a destination.